Right. Thank you very much, and thank you for inviting me today. Before I begin, I would like to acknowledge the traditional custodians of this land, the Gadigal people of the Eora Nation. I would also like to pay my respects to the elders past and present and extend that respect to any Aboriginal people present today. I work in Sydney Local Health District as a tobacco treatment specialist. My role involves providing counselling to help people quit smoking, delivering training to staff across the district, and also conducting tobacco-related research projects. I'm here today to present on the outcomes of a project focusing on working with carers and mental health consumers in providing quit smoking support. I presented last year on the preliminary findings. I'm here today to talk about the outcomes from that project. Before I discuss the findings, I'd like to acknowledge the Cancer Institute for providing the funding for the project, and also our partner organisation, One Door Mental Health, and Joanna Freeman, who was a project officer on this project. I'd also like to acknowledge the carers, consumers and peer support workers who provided support. I'll just go back to this slide. Wadad Danoom is a peer support worker who was meant to present with me today, but unfortunately she's unwell. So I'd just like to acknowledge her participation in this project. Like all good projects, this project came out of a corridor conversation with a mental health worker, and this mental health worker identified that there was a gap in resources for carers around providing quit smoking support. From that conversation, I conducted a literature review, and I found that there was no research around carers providing quit smoking support or what their support needs might be. I also reviewed resources that were available, and all I could find was really some brochures and a few online tools. There were no educational resources for carers to upskill them. So who are carers? A carer is someone who actively cares for a person with mental health issues in the context of this project. They may be a family member, a friend, or someone who has a significant role in a person's life. So why is it important to engage carers in smoking cessation interventions? Well, tobacco control strategies have been effective with the general population in reducing smoking rates in Australia and worldwide, but they've had very little impact on people with mental illness. The smoking rates are still really high. Research shows that people living with a mental illness tend to smoke more heavily and are more nicotine dependent, and die approximately 25 years earlier than the general population. They're also less likely to be offered quit smoking support by health professionals, but they are as ready to quit, they are as interested in quitting, they just may find it more difficult and therefore need a bit more support. In terms of carers, research shows that carers' support can improve consumer participation in treatment and psychological outcomes, and can improve consumer use of medications. It's also been found that carer involvement can improve relapse rates through early identification. So in my role as a clinician, I work primarily with mental health consumers, but also carers, because carers come to appointments with the consumers. And their role, I found, was really important. What I might talk to the consumer, but what happened at home when they went home and what the carer thought about quitting medications played a big part on the treatment outcomes. So the project. The project aimed to enhance the capacity of carers and mental health consumers to provide quit smoking support. The project was broken into two parts, where we had a research component and a resource development component. The research component involved a survey with carers across New South Wales, and we used the information from that research to inform the development of a suite of resources targeting carers. And I'll talk about those in a moment. And it was ethics approves the survey. So in terms of the survey, it was an online paper-based survey that we disseminated between January 2017 and May 2018. It was emailed to over 600 carers across New South Wales and disseminated through carer group programs. We were interested, we had 133 carer respondents, which might not seem like a huge amount given there were 600 carers, but carers are really busy in their caring role, so it was a pretty good response rate, we thought. 72% of carers surveyed were aged over 50 years, 80% spoke English at home, 44% were employed and 20% were on a pension benefit. I won't spend too much time on the outcomes of the survey because I did present a lot on that last year, but this is an update on last year's outcomes. Essentially, the survey highlighted some important carer misconceptions and a lack of knowledge about quitting with mental health consumers. The majority of carers thought that smoking reduced stress for consumers or were uncertain if it did or not. Most carers thought smoking improves mental health symptoms, and a large majority thought quitting might be harmful to mental health recovery. These findings highlight the need for education to address these misconceptions. The graph on the left is showing the difference in smoking rates between carers and consumers. As you can see, around 15% of carers reported being current smokers compared to 70% of consumers they provide care for. Of the consumers who smoked, 51% were smoking more than 20 cigarettes per day, and carers were also more likely to be ex-smokers or never smokers than consumers. The graph on the right is showing you the smoking inside the home and carers' exposure. And as you can see from here, the carers indicate they are exposed to smoking inside the home at much higher rates than the general population. So around 36% of carers that we surveyed were exposed to secondhand smoke, compared to 6% for the general population. This is important because there's clearly a need for targeted strategies to reduce that rate among carers. The survey also highlighted that most carers were uncertain whether quitting medications was safe for mental health consumers to use. But despite these misconceptions, most carers indicated that they were willing to provide support to consumers. So we used these results and other findings to develop the resources. And these are the suite of resources that we produced for the project. I like having real things. So this is about the size, and this is the Arabic brochure that we produced, so we had them translated. So the first resource we produced was a brochure, and this was done in consultation with carers and peer support workers and consumers. We've had that brochure translated into Arabic, Chinese and Vietnamese. These are the populations with high smoking rates. All resources were focus tested. In addition to these resources, we've also developed a 6-session group education program. We have a detailed facilitator manual and participant manual, and we also have a video that goes with all those resources. These resources, there's links on this slide which show you can access these resources online through One Door Mental Health and Sydney Local Health District Mental Health Service. Okay. The other thing we did was we ran a Train the Trainer for carer advocates across New South Wales. Carer advocates are people who run groups with carers, and we did pre and post assessment of their knowledge around quit smoking. And what you can see in this slide is there was a huge change in their knowledge around benefits of quitting, barriers to quitting, recommended quitting medication. The dark blue is before they attended the training, and the lighter blue is after training. And they were from across New South Wales. We also had the Lebanese Muslim Association participate in the Train the Trainer. Okay. So the project aimed to fill a gap and provides important information about carer barriers to providing quit smoking support. It highlighted the need for more comprehensive educational resources to address the gaps and motivate carers to support cessation. We plan to continue to monitor the uptake of these resources by carer services and the impact on carer engagement. The project has been nominated by Sydney LHD to go up to the Ministry of Health Awards. So if we're successful, there'll be further funding allocated to the project. So that could mean that we could run more train the trainers, we could do further evaluation, or we could also expand the project to young carers, communities and Indigenous carers. There's definitely a need within those populations for more research and more resources. Done. Thank you.
Okay, again, time for, here we have, question. Thank you.
Charles from Western New South Wales, LHD. I found something interesting in your data there. The almost 78% of your carers were looking after people who were smoking. And I'm wondering if there was a correlation between people who were looking after carers thinking that smoking enhances their mental health or not.
Sorry, I'm not sure I understand your question.
I'm saying, was there a correlation between people who were looking after smokers?
Yep.
And their reflection on, or their attitude towards smoking as a...
So the carers smoking?
Yeah, as a more of a not this carer smoking, even carer smoking, but the patient who was smoking. I mean, 78% of your clients were smokers, the mental health clients. Yep. So I'm wondering if the carers who were looking after those type of patients thought it was beneficial for them to continue smoking or not.
Oh, yeah. So that's what we found, that most carers thought that smoking helped mental health. So there were, and some of the misconceptions we identified were actually the barriers for why the carers were not providing quit smoking support, or why they thought it wasn't a good idea to quit. So the main things we found was that they thought it was better for mental health, that they thought that quitting medications were harmful to mental health, and also that quitting itself was harmful to mental health. So what we tried to do with all the resources we've developed in the training program is to address those misconceptions. But yeah, they were identified barriers. The thing we came into, we thought that consumer smoking rates would have an impact on carers smoking, but we didn't find that. So even though the smoking rates were high for consumers, they weren't necessarily high for carers.
Okay, thanks very much. I think we need to move on. Thanks, Louise.
Yep.